0727081605 gose 0727574835 niko bakwigora amatukonse sheiki mama tifi mitumba obokoreri bya bwa mitumba urigene. Kwabiri gukora iryo bugwenya sora konyo mu cyando usasengaki otaranyora bono tokumia Ronya Hospital Keumbo niyo korariya obokoreri bwekerero bwa hafi yawo asenjira ensera kigima niko bwatobokoreri bukubwatya ase inpatient na outpatient maternity services gochya sabasubati bali bebwatranetie X-ray na scanning gochya sabali abatu aliro mu cyando kwa mauga amona gukuringorya omubiri bwensi mbabwate modern lab iyo bwate chimashini kiekerero asukurwa machibwago abwabwo fully equipped pharmacy asabwata malyogo onsibi barwire mbali kogenda kurya malyogo isiko ali bakurikirwa n'umunyagitari major na minor theater asabarwire bagokorerwa operations uburwaria bwa maiso asabwate chimashini cyo gupima elikoko wenya gusiko kwa ebirore korosigwa amaino gusibigwa amaino chinchera chia new technology newborn machine asabana bali abatarayikirana chingaki bakwiburwa bakorererwa 24-hour ambulance services chigokoro bosombi bw'abarwaire chinsemerongo ibere na inyekeralituko uburendi bw'abarwaire ase chinchera chitakeire niho tumye insurance ya sha iyo kweli kekigima na inde kwarorerwa kekima Ronya Hospital Keumbo nigegotoke bara ya kisi keroka chimita chimisano kurwa Keumbo market na buku banyorase namba yesimi 0768350999 Ronya Hospital Keumbo, modern medicine we care.
Karibu Mwalimu International Hotel Kisii kwa mandhari ya kupendeza. Tuko na vyakula vitamu vinavyopikwa na wapishi waliohitimu kama vile samaki, nyama choma, kuku na aina zote za vyakula vya kienyeji. Conference hall kwa kufanyia mikutano aina yoyote, vyumba vya kulala vya hali ya juu, vinywaji mbalimbali kwenye bar na restaurant, mahali pa kubarizi, mchezo wa pool table na parking ya magari ya kutosha. Pia unaweza fanya booking kwa sherehe kama vile harusi, baby shower, graduation, birthday, sherehe ya watoto na zinginezo. Tunapatikana mjini Kisii, Mashauri nyuma ya jengo la Mwalimu Sacco. Kwa mengi zaidi, tutembelea au kupiga simu kwa nambari 0792267062. Mwalimu International Hotel, at your service.
Kwabiri kugwaturwa n'umubere yasenga kikore nditoranyore nchira yokugwenya erago konye tokumya pia sauna nenchira yobugwenye bwatobuya yogo tumeka chinko amonemete yegenka yani herbs yachire ili kugwenya omuberogo pia sauna nige gokonya emechando unabono gokeani esumu nyinge asumubere yani detoxification gokeya chikiro chinyinga asumubere yani weight loss komentenchira yamanyinga waka asumubere increase blood circulation kwenye mochando wichinengo yani arthritis recovery risangwa korokana buya yani skin rejuvenation stress management amona yanda mange boigo pia sauna ankwe na bale obukoreri bwa massage services scrubbing lorries, waxing amona facial. Wiga solioraganie ndagira, ntubwate hotel asokobeke oda, ndagire joraganie kolia. Inyora, ekero kwa nyoro bokoreri bwa PI sauna, niko bao kwa free bottle drinking water, watermelon, amona chai dawa. PI sauna, niko toka nyanchwa Kisii town, opposite Leadway petrol station. Asamange bahakire simi gose WhatsApp ase number 0728 412719 Gose 0748 799011. PI Sauna, a journey of relaxation on self-care. Edukaya Uhuru Superstores Limited Kisi. Wana nigo ya ihoire first class showroom. Ija abiri ntanga nigo chakiwa hasoro gongorwa South Nyanza na South Rift sabateja. Bago chaberorera mabati au kuruase company ya mabati Rolling Mills. Nigo babuata bataramu. Nechibundi bago korosire bunota keire gochora. Amabati ayura agachire. Umuche amone chinyomba chibyasara. Au. Babuata mabati yechi warrant kuri miaka 5 ebere wiki miaka 50 munabono charcoal grey, tile red, brick red, sky blue, maroon, chocolate amona yanda mange. Uhuru Superstores baigo nige bwati machine chile chiko chogania erangia elio konyora erangi uganetie emanyikaine buna crown paint color mixer nigo bwate chibundi abo barakwe abo semiguri chirangi aho chakira economy kuika premium ichura nyare gwaka isiko na image nyomba elikoroka na buya kuruase company ya crown paint inyora Uhuru Superstores Meru yoka sorogongorwa South Nyanza na South Rift Jabire Ntanganiko igora first class showroom ya mabati Rolling Mills Hamba buigo Botuare machine yogo chirangi Chia Crown Paints emanyikanete muna Crown Paints color mixer Korwa USA Ilikorenta obo koreli Inka Uhuru Superstores lige gotoko muchibu songo Uhuru Complex angena Safaricom Boiga Babuatu rosagia ronde ine JM Towers Ijuira angena Credit Bank Kise Baakire simiase namba 011-1161-500 Gusova likere email info@uhurusuperstores.com Uhuru Superstores, the people's choices, guaranteed lowest prices. Karibo nyumbani.
Ukiza machonsi tata Nichua songo marana maya chiroro
Etaya TV Oborabu Wagusi.
Kigimo mwanchumuri weta television ekero nande twachakire asomorobiri abokanya na daktari ya by mistake ekero twachakire beno mwanchumuri tosabo kwabira nelina bon twasira asomorobiri onde rena ote yarengeteketeka simambi ya boniga ekogera litangani twabeire ase twengana wakiri the state of the nation monande twikire ekero twanyana daktari wakili otoiro poseme kurwa sensemeli ya mangana yubu wakili yendiri jiko nalibono tetonyore amangana ya mangana mento kosa mangana afya maite butambe tote buna goikotware afya irengia afya pola si pora afya afya irengia kimegia kera ekero bwata afya irengia gosobo ngobo bole biya nigo motachiri kena bora twareta ekibasi nyinge lakini obwate emechande mengi ko mugano itikira se studio daktari acho tatebiri taria kigima mumanye asemambi yaboniga ekiagera na kitoju kwana mangana mental health awareness ninki ekogera mjiri chenjani yesikije onto gwetera na ninki ekogera ire muhimu tumanya mangana mental health like tumanya semambi yaboniga daktari nje narabaira kurumambi 12 mpaka bono bono gwachiri jinsi jitengwariga kigima daktari oswa ase studio inde tuchake naye kurbono mpaka chinsa inye chiri tuko dialero nabuko kwani mwanchu mureri oturigiti asemambi yabonega kunitiganda kwariga daktari oransugeri asemambi yabonega kigima na tukwatera na Joseph Mokogoti na ruri kurasa nseme kamera Joshua Uta kurasa nseme transmission amo na Ruth Kimma na barasa nseme inde yesterday daktari kwani mwanchu mureri oturigiti asemambi yabonega gadene ntuda entanga ko swetati hospitali.
Asante sana.
Yes.
My name is Dr.Gideon Munaru. I am a consultant psychiatrist. Indeed, I am glad to be here. Thank you for having me.
Yes,
Thank you for your invitation. And our topic, as you say, is mental health awareness. That is something we do, and we are passionate about it. There are many misconceived ideas, feelings, and thoughts about what mental health is, and in most cases people do not understand what mental illness is, and because of that we have got a lot of suffering in our communities, in our population, and that is what we would like to demystify. That's what we would like to help people to get out and seek for help, because by promoting awareness, by making them to know that actually there is help out there, they are most likely to come out. A number of people have come out, they have received help, have been treated, they are doing well, they are now recuperating. Yet we still have a great number in the community that is still suffering. Just a little statistics, if I may give, it's been found that 1 out of every 10 Kenyans is suffering from a mental illness.
And 1 out of 10.
1 out of 10.
So kama sisi tuko 1 2 3 4 5 avatano go yo Munaru watu mchana.
At least you can find, if we add on some other people, you'll find some people,
at
least one of us is suffering from mental illness. And 1 out of every 4 people that you come across has suffered from mental illness at one stage. Yes, and then according to the World Health Organization, statistics show that mental illness is the leading cause, one of the leading causes of disability-adjusted life years. By disability-adjusted life years, I mean the time that you have spent out of work, maybe because you are sick, maybe because you are incapacitated and therefore you cannot contribute productively to the economy when you have mental illness. So mental illness contributes one of the leading, and depression and anxiety are the leading causes.
Weza daktari ono wasio dikigima gase ninga ni uchukutupeka nande kigusigeke kogarumeta abantu betu no kumaite daktari kiagira abantu betu bari skali betu pamanye amanchando yo mental health litanga letura chakira daktari kero tumanyi mental health kieke because we need to understand what's mental health. Daktari. Yes,
thank you so much. Indeed, that is a very good question, Brighton. Whenever we are talking about something, people should first know what it is. When you say meat, want to talk about meat, people want to know, is it goat, is it cow, and what have you. So what is mental health? And therefore mental illness consequently. Now mental health refers to your complete wholesomeness, the way you do things, the way you respond to issues, the way you handle stress, the way you cope with everyday stresses. That is mental health. And one of the things that I also want to put across is that there is mental health and then there is physical health. Just like you take care of your physical health by exercising, by saying I must eat well, I should ensure that mosquitoes don't bite me, I should ensure that when I cut myself, I take myself to a doctor to see me. That is the same way that you're supposed to take care of your mental health. Yes.
Mental health, when is it mental health and mental what's the difference between mental health and mental illness?
Thank you so much. So mental health is a general term. Mental illness is when now you're having a disease, which I'll mention later, I'm sure, in the interview. It's coming after this, maybe. Now, mental illness is when you're now presenting with some symptoms. We call them things that we use, or signs that we use to say this Brighton today is presenting with symptoms that maybe tell me he has schizophrenia or he has depression. Now, mental illness is when now you have deviated from the mental health. because of maybe your incapacity to handle maybe stress, or maybe this is something that is flowing in your family line. We have got some that flow in the family line.
Yes.
Or maybe something has happened to you and you have fallen so much below your capacity to be able to withstand stresses of life. Maybe schools have opened, you have 5 children, they all need to go to school. School fees is amounting to 300,000, you only have 10,000. You go into a lot of thoughts, your mood becomes low, you lose interest in most of the things that you're doing.
Yeah.
That is already mental illness.
No.
Now when it is not managed, it continues progressing and deteriorating, and eventually you have great problems. Now I just want to come clear that it has its causes. What you see someone expressing is actually a product of what is happening inside the brain. Now in the brain we have some things we call neurotransmitters. Why I'm able to talk with you like this, to see the cameraman, and you see the beautiful scenery that is in Etaya TV, is because my mental faculty, my neurotransmitters are in balance. The way, I should say, the way God made us. A human being has a lot of small micro transmitters that are produced on daily basis. And
like us, we are using transmitters to transmit.
Yes, now you are using transmitters. Now for us in our brain, we have neurotransmitters. I want to give an example of an engine. Every engine has small connections that if any one of them fails, then the performance of that engine will not be optimal, or the vehicle or whatever machine it is will not work. Now in our brain, those neurotransmitters must be in a specific balance. For example, I would like to give maybe an example of maybe dopamine, which is a happy hormone. For example, when you receive a good gift and you feel good, the reason why you're feeling good is because that dopamine is there. Trust me, if you are not able to produce dopamine, even if you are rewarded, even if you receive a good thing, even if you eat the food that you like, you realize that there is no pleasure that you receive. And because of that, what happens actually is that you are not able to express yourself in a good way. Now we have another one called glutamate. Now those neurotransmitters are many, but any small imbalance will either lead to the psychotic line or the mood line. Now in the mood line, we have diseases like bipolar affective disorder. We have got diseases like depression. We have got diseases like anxiety, stress related. Those are the mood disorders. Then we have the psychotic line. Now in the psychotic line, we have brief psychotic disorders. We have got substance related psychotic disorders. We have got schizophreniform, schizoaffective, and eventually the mother of all, schizophrenia. Now, all this comes about as a result of an imbalance in the neurotransmitters that you may be having. And then there are causes. Now, these things I talked about, stress, genetics, and stress and genetics can affect the balance of what? The balance of neurotransmitters. So it is important for us to know that the way I conduct myself day long impacts on my capacity, my capability to do what? To get mental illness at one time. There is a way Brighton can annoy me, but I can handle it in a more diplomatic way by seeking reconciliation with him. And as well, I can extrapolate it, hate him, begin fights, and that is consequently affecting me. I want to give an example of countries that are war-torn. For example, Democratic Republic of Congo. Statistics show that we have got a lot of people in those countries with stress-related mental illness, especially post-traumatic stress disorder. Then why is it not in a country like Kenya or Tanzania, which generally have peace? It is because the stressors that are in that country are not in this country. And those stressors cause a gradual decline in the neurotransmitter dopamine. And once that has happened, it renders them not capable of leading a normal life. And as I said earlier, mental illness is a all-round thing which is actually affected by the way you lead your life and the balance of these neurotransmitters.
As we continue, Daktari, what is the relationship between the mind and the mental health?
The mind.
Yeah.
Now the mind typically is the general composition of the faculties of your brain. Now the mind, for example, is what you use to see the society. Now the mind has got part of the mind is things like the ears, the eyes, and the brain at large. Now the human brain has got a lot of parts, should I say a lot of compartments. Now all of them, when they are working well, they all see things correctly, interpret things correctly, and at the end of it all lead to the production of something that is normal, or viewing something that is normal the way every other person would appreciate it. Now when the mind is not correct, what is actually telling you is that part of the mind or part of the structure of the brain may be having a challenge. For example, if you have a tumor or what we call a cancer that is growing in the brain, you may find that because of that, it's producing pressure in some parts. Therefore, blood will not be able to reach some parts of the brain. And once blood is not reaching, it implies that oxygen is not reaching those parts of the brain, and therefore there will be an interference with the way the mind will work. And because of that, the mind will be different from the way your mental health is supposed to be. And that's actually one of the, you'll actually start to present with some signs of mental illness.
Yes. As we continue, Daktari, you have said that we have mental health and physical health. Now we would like to understand which one comes first. Should we have physical health first, or we have mental health first, so that we can maintain our fitness?
Thank you so much, Brighton. Indeed, that is a very brilliant question. Yeah, you always need to know what comes first. You have heard people say that between the egg and the hen, which came first? I will not answer that question. Now, this actually should be understood like this. Between the engine and the body of the car, which one is more important?
The engine.
That is correct.
It's correct.
Very
That's
correct.
Right,
Because if you have the body of the engine, and when you have the body of the vehicle, and you did not have the engine, I think it will just remain there. It will not help you.
The body will be tested.
That is true. So I want to state categorically that there is no health without mental health. Indeed, when you look at even organogenesis, when a human being begins to form in the mother's womb, let's say in the uterus, in our terms as doctors, one of the things that begins to develop first is the heart and the brain. Because now the brain, once it's developed, is the one that gives instructions for these other parts to develop during the process of what? Organogenesis. And just to deviate a bit, that's why we normally insist that during the first 3 months, the mother should be careful with what they eat, what medication they eat, because they can interfere with the brain development, and because of that, predispose even a child to mental illness. But as we go on, I want to say that mental health is more important than physical health, because when you are mentally sick, you cannot even be able to recognize physical illness. But if you have physical health and you are mentally disabled, again, you're not able to maintain your physical health. In fact, your physical health will continue to be worse.
That's very nice, Dr. Now we have said about the mental health. Now we want to complete our headline. That why is it important that we talk about mental health awareness?
Thank you so much. It is very important for us to have this conversation over and over, not just today. Indeed, the whole world over, this is a conversation that has really gained momentum because it came to the realization of the World Health Organization and National Institute of Health of the United States of America that people have focused so much on physical illnesses like tuberculosis, physical illnesses like HIV, and a lot of sponsorship, a lot of research was going on around that. But they forgot about the technological advances, the stresses of the modern life that has been putting people down. And not long ago, it was discovered that statistically, the number of people that were having mental illness were way more than those who are having physical illness. And therefore, there is a great need for that awareness to be there so that people can know that there is help, people can seek help, people can recognize help, and more importantly, in our community and Kenya at large, in our African setting, there is a way people think about mental illness. It is generally not understood. And because of that, when people have mental illness, they seek alternative means from people even who do not understand. I want to say that I've met some people who think mental illness is caused by some spirits, is maybe a witchcraft issue, and all that. And one brought a patient and said, okay, Dr. let me see if you will heal that patient, then perhaps I will go back to the community and inform them that actually this can be healed. And we stayed with the patient in the ward, and the patient got better. So I want to say that as you're listening to us here, there are people in the community who have received our services, and because of that, they have known that there is cure, there is help, so long as you do not delay so much, so long as you come in time. Therefore, the most important thing as to why we need to do mental health awareness, it's because it's affecting a great number of people in our community, and people do not know much about. There is a lot of misconceived ideas, and because of that ignorance, people suffer without until they die without knowing that they can receive help. Yes.
That's very nice. Mwanjumuri with other vision nigo to endete kukwanda mangana mental health ya sibambi yeditiko dialero kima ya daktari endete kutoherera na gotetebina why tutakiro twara this mental health awareness ige kugerana na ate abone abantu bali 10 oyo mugigatwara umuchando asa abantu bali bane oyo mugo ikebe oiteiro umuchando uyu iwono tibanyiti ngutugurira symptoms, signs and symptoms atumajugurira ngakitogo koro mujando ngakitogo yo reduce as sensito ya Kenya daktari nachukura tebe bana inchikima yes na toreban bana bane 1 2 3 4 batano igoyo muito na rubwetiro mujando yo mental health challenge asibari komi oyo monaro ere ubwato mujando yo igona daktari atoerera kolengana ne study iyo ya kolirwe ase kolengana ne kwende boroli bwa kolirwe nani walifanya hiyo utafiti ni World Health Organization.
Now in our setting, we have some people who have some doctors who have done research. We have got Nakada. We have got one of the researchers like Professor Atwoli. They have done that research, and statistics is there. But this is taught by the World Health Organization. So typically we say World Health Organization.
Okay. Yes. Doctor, before we go to signs and symptoms, our viewers, they need to understand. Ngotakere kwa nyoro nchumbe ya mental health awareness nuri obwato mochando onde bwenzi mokenya onde nuri utaranya ro mochando modern specific kwa nyoro sentence. What can you say?
Now when you want to get information about mental health, it is important to seek that from people who are qualified. Indeed, mental health is I would say a specialty that people are not so many. Currently, like in Kenya, we have about 142 psychiatrists. And currently, like in Kisii, we just have a few, and I'm one of them. I want to state that there are a lot of information. There's a lot of information out there, but it is not correct. So it is important to come forward and seek help from hospitals. Definitely when you get to hospital, they will lead you to a correct department, and you'll be able to receive help. Whenever you have symptoms, you have issues that you do not understand, there is high chances that is mental illness. You go to a physician, you go to a clinic, a dispensary, somewhere, you're treated, but still you feel that you're not satisfied, there is high chances that there is mental illness. It is all therefore important to seek help from a qualified mental health practitioner. And like in Kisii, we have KTRH, even you have private clinics that are handling this.
In most cases, Dr. before we go to signs and symptoms, in some cases, you can find the way Mokot can do things. You can say that you are a mental case. Is that the case? For instance, I can do something here, Josh can tell me, Brighton, you are a mental case. Is that the case?
So why people say so, it's because you may have deviated from the way you are supposed to do it normally. There is a way I'm supposed to behave. I'm expected to conduct myself. And then when people find that I'm not conducting myself according to that expectation, then they may think something is wrong with me. And indeed, as we said, mental health is when there is an imbalance or rather breakdown in the neurotransmitter system. And because of that, yes, the normal way in which you're supposed to do certain things, you don't do it that way. Indeed, one of the symptoms of psychosis is that someone may be disorganized in behavior, may be disorganized in speech. And when people see that, they think, your nuts are loose. Sometimes you have heard people saying like that. And that is exactly perhaps what people may be referring to. Just a deviation from the way you are supposed to do things. For example, if we find you walking in the middle of the road, probably we think something is wrong with you, because there are high chances that you should know that a vehicle can knock you. You get the point? And therefore, when you are near people that are caring, they will rush to rescue you because they think you are dangerous to yourself. Yes.
Maybe I think we can go to causes and then we come to center symptoms like that.
Yes.
What causes mental health?
Okay, so I presume you're saying mental illness.
Mental illness, yes.
So mental health is sustained by many things. One of them is by us by maintaining a good diet. That is one. By maintaining good relationship with people, so that we do not go to the extremes. Either we are too happy or we are too angry, because that affects.
You're not supposed to be too happy.
You're not supposed to be too happy. There is a limit. There is a limit to be. Like if you want to laugh the whole night, I don't think that is okay.
So you are.
Yes, you cannot.
We have a method.
If we are in a meeting, if we are in a meeting and for you are laughing all through, then you are telling us that you are happy. Probably there is something beyond that. Yes, if everyone is happy, things are being spoken, good things, you're being even issued gifts, you're even getting a promotion, and you're not happy, we think you have a problem. Probably if you come forward, we can be able to help you. But as doctors, we do not go forth, diagnosing people. It is not our responsibility. However, when you come forth, then you can receive help. You know, in health, just like in any other sector, there are laws that govern the way we work. And therefore, Brighton may behave like this. We can only suggest to him that probably if you seek help, you may be able to be assisted, but we cannot force our help on you. Yes, that is it.
So what causes mental illness?
Yes. So mental illness, as I said, the primary cause, they say number one cause, sometimes it may be genetic. That means it is flowing in the family line. Yes, just like we have some physical illnesses like hypertension, like diabetes, which flow in the line, like some cancer, like breast cancer, they flow in the family. That means if the parent had, the grandfather had, there is a high likelihood that the other generations that come after him may also have it. So in mental illness, the leading cause, we think, is inheritance. Then we have other physical issues that can lead to neurotransmitter imbalance. For example, it has been found like children that are born in very cold or very extremely cold environments may have issues with the brain development, in the sense that at the end of everything, some brain sutures do not close very well, and because of that, they are more predisposed to getting diseases like cancer. We have some viruses like influenza virus. If a child is affected by that virus when they are still young, there are high chances that in the future they may present with what? With mental illness. We also have, like I told you, neurotransmitter imbalance. Now, this neurotransmitter imbalance have got several causes, and one of them can be things like substance use, substance abuse. By substance abuse, substance use, or drug abuse, I mean things like alcohol overuse. I mean things like cannabis, commonly called bangi. I mean things like cocaine and marijuana and all that. Those things, those substances, continued use, continued ingestion, and addiction to them lead to a depression or a change in the normal structure and normal composition of neurotransmitters. Typically, to say, they promote production of some neurotransmitters at the expense of others. And because of that, it leads to a situation whereby someone is getting a disease either at the psychotic line or the depressive line, depending on the type of neurotransmitter that is in high quantity or in low quantity. And as we go on, you realize that lifestyle is what matters most. The kind of lifestyle that you lead, just like in physical illness, diabetes, hypertension, they'll tell you change of lifestyle has a significant impact on your disease, on your health. And this, they mean that diseases like hypertension, diseases like diabetes can be affected by the type of lifestyle you lead. For example, you don't work, you don't do exercise, you're just seated there. You're eating a lot of fat, you're eating a lot of sugar. There are high chances that you'll get lifestyle illnesses. Now, in mental health, the same is true. Human beings are created or are made to be social, beings. And when you become antisocial, when you begin to alienate yourself, isolate yourself, when you begin to see that maybe talking to people, working with people, just staying in a dark room is all you want, then also it is leading to the change in the neurotransmitters that you have, because these things are produced to be used. Now when it's realized, the brain realizes that they do not need to be produced, then you are being transformed from actually a normal human being to something different. And that's how you find that now you begin to display certain characters, you begin to display certain behaviors that are actually not according to the way human beings are supposed to behave. Now when you look at all that, it is all about a change in the neurotransmitters. A vehicle, an engine, can have several causes as to why it can break down. But the main reason as to why it breaks down is because the transmission is not correct. And therefore, that pathway of neurotransmitters in the brain, it can be affected by several things. It can be affected even by cancer. It can be affected by even diabetes, because diabetes, hypertension can lead to accumulation of sugars in the brain microvessels. And because of that, there will be reduced oxygen reaching the brain vessels, brain tissues, and the brain will therefore not work well. And once the brain is not work well, you will display certain symptoms that are not normal.
No, we're going to go to signs and symptoms, Daktari. But can drug abuse cause mental illness?
Thank you so much for that question. I'll again say that is a very well thought out question. Yes, it can. Drug abuse is where you use a drug, even Panadol, other than the original intended purpose. Now we are supposed to, we are supposed to use medication to reduce pain, to cure disease, and to help us enjoy a good life when something has gone wrong. But then when you just make a habit of taking it in, what happens actually, the body gets accustomed to it. In most cases, people take these drugs in because there is a good feeling that they associate with. For example, those who take cannabis, they say there is a good feeling that they get. And I agree with them. Why? Because this cannabis, this alcohol will lead to an increase in the production of dopamine. And as I say, dopamine is a happy hormone. That is one of the neurotransmitters. Happy hormone. Yeah, a happy neurotransmitter. What happens actually, this dopamine will make this person have that good feeling. Removes himself maybe from the thoughts, from the pains that he has been having. And therefore he craves it. He longs to take it. But as you know, when you take something in our bodies, it is metabolized and it does not remain there forever. So the effectiveness of that drug, that substance which has been taken, keeps going down, and it reaches to a level whereby the body now tells them, the level have gone down, I need you to recharge more, I need you to increase. You get the demands now. Yeah, the body demands. And the demand is what we call craving. You develop withdrawal symptoms immediately. Someone begins to feel bad, and something inside him, makes him look for all possible ways to be able to take in this drug. And that's why we have got some people committing crimes, stealing, so that they can be able to buy this cannabis, this alcohol, because of the craving that is there. And therefore, I want to say that actually drug abuse leads to drug addiction. Now, it is this drug addiction that when it is sustained for long will lead to mental illness. Now, I want to say that according to statistics, continued use for drug like maybe cannabis, bangi, for more than 18 months consistently can lead to permanent conversion to illnesses like schizophrenia, and that's the psychotic line. And alcohol, which is the commonest in our society, has many causes. When you go to most of our wards, you find alcohol-induced psychosis, alcohol-induced anxiety, depression, all that. And therefore, I want to allude that alcohol, substance abuse, substance addiction can lead, to mental illness.
Definitely can lead, but to some extent, you can find somebody who has taken these drugs, like bangi or changa or what. You can be able to speak fluent English than somebody who has been in school for more than 18 years. What happens?
Thank you for that question. Now, as you said abuse, and I went on to say addiction. There are some people who take this alcohol with moderation. There are some people who take this alcohol with moderation, or substances with moderation. Now, we are saying that statistics have shown that majority of the people who use these substances stand a chance of suffering a mental illness in future. Again, in our bodies, for any illness to come in, there are features, psychic features that are personal to me, personal to you, that will promote it or struggle not to promote it. And therefore, you find that we can be exposed, for example, to the same stressors, and then you break down and you never break down. So those are a few exemptions. Now I want to say that I will not put myself to test myself to use cannabis, to use alcohol in extremes, because I want to find out if I'm among those people who cannot suffer from mental illness or not, because it can be too late. But what I want just to say is that the conversion rate is increasing as generations go by, because most people this day will say the alcohol they take these days is not the one they used to take some times back. Probably there is an auto-refining, there is mixing, and that actually works so much on the brain. But I want to state categorically that statistics have shown that overuse, continued use, addiction to substances is one of the leading causes of mental illness. And indeed, visit any ward, any psychiatric ward, you'll find that mental illness, mental issues that are due to substances are the leading.
I'm going to read some messages here, but we need to go to signs and symptoms. Okay. Before we go to signs and symptoms, Dr. We need to understand, is there a relationship between stress and mental illness?
Thank you so much. Indeed, when you see me talking about an imbalance in the neurotransmitters, that is already stress. Now that is psychological stress. But we also have physical stress. For example, some physical conditions like diseases, like physical illnesses. When someone has physical illnesses like hypertension, diabetes, cancer, he already has physical stress. Now that physical stress is impacting on the psychological stress, which will lead to psychiatric illnesses. I also want to say that stress in life, the social stress, social stressors are some of the leading causes of mental illness. Indeed, people break down much during the time when they are stressed than when they are not. Even people that are on consistent medication, you find that if they do not know how to manage or control their stress, there are high chances that they'll break down again. So I want to say that stress is directly related to mental illness, and also say that stress is an integral part of mental illness. Whenever I'm seeing a patient, I will see him finish, but one of the things that I will also do is find out what actually caused this. Do you have any stressors in life? And that is very important.
That's very nice. Allow me to read some SMS and text here so that we can go to signs and symptoms daktari. Allow me to read some few messages that some viewers have sent. Kumachumuliria ni gotoendelea kwa na daktari ase mambi japonika Dr.Gideon Munaru ekarago toera mangana ringete mental health ekaro to the mental health awareness nacho tebe wiki yo somutinyo yo kero toringete gotwara afya ya itiringia daktari otebere no goseka mono is a problem. Na manyete lakini otebere na ogoseka asudata keri goseka when people are crying maybe you need to cry. When people are smiling, you need to smile. You need when you are vice versa, so meaning you have a problem.
That is not really what I meant.
Yeah.
You may be with people and they laugh, they're smiling, but the magnitude of the thing that is making them to smile or to laugh may not be amusing you. You get the point?
Yeah.
Like when you are with young children, simple things, even the connections we have in the room, may be amusing to them, but to you who is used to them, it may not be any amusing to you, and therefore they may be happy, they may be laughing. It could be like a good outing for them, when for you it is normal. You get the point? And therefore, where I'm talking about is in the case of the extremes. I am talking with you, giving you something, maybe rewarding you, and the greatest expectation, a reward gives something, some happiness to a human heart. But then your response is opposite. That's when we think that there is a problem.
Okay, yes. That's very fine. Carlton Otho, out there watching live from Nairobi. Santi Musurugesu, watching live from Nakuru City. Subscribe, Jeria Kirwa, then listening Kurwa Ngumbu, Manam, Berlin Kingdom, Waikainka, Kisi County Sant. Ready Kundua, then watching live from Bitale, Bonchari, Bokere, Morenda Suneka, with Honorable Senator Isio Kenyuri, Ayendo, and Thomas Ubuki, Nyanchoti, Unia Umawa. Isaka Umeno, almost a permanent that they are Kurwanya Bituna, Kona Sisi. Now, then how can I know that a mental illness? In a talk agenda, to manena signs and symptoms. Liora Rolena Ki, or say no chiwad. Through signs and symptoms from daktari atatuambia utajua kama uko na shida, and then atatuambia kama uko na shida ya mental illness, kuna matibabu unaweza fanya aje. Na baadaye atatuambia why are we championing this mental health awareness this month, ndio tujue baadaye. Lakini let us go to signs and symptoms, daktari.
Thank you so much. Now, signs and symptoms are not general, because mental illness are subclassified. Now we have the very predominant one, psychotic disorders. Like I said, in psychotic disorders, we have got diseases like a brief psychotic disorder, which has lasted maybe a period of 1 day to about 29 days, that is less than a month. Then we have schizophreniform, which may be 1 month to less than 6 months. Then we have schizophrenia, which is more than 6 months. Then we may have schizoaffective disorder, where someone is presenting with psychotic features and as well mood features. Now I want to break down and say we have got psychotic symptoms, we have got mood features, and in mood features we have got mania, we have got depression. I'm going to come to all that. Now, psychotic features is whereby someone's brain or presentation or behavior to a great extent is exemplifying some disorganization. For example, we have a symptom we call hallucination. Now, in hallucination, that is a perceptual disturbance. You've heard, or you may see people saying they feel like some insects are walking on them. That is tactile hallucination. When you look at the skin, there are no insects there, there are no birds walking on the skin, and what have you. Someone can be there telling you, I'm seeing these people. They are with guns, they are coming to kill me. And we are seated with you like this, and for you are not seeing. So you begin to wonder, is it true that your eyes are not seeing? Or do I have some powers which you do not have? You get the point? And that's why some people end up saying perhaps they are spirits. But actually what has actually happened is there is a perceptual change. In the normal body of a human being, there is signaling, neurotransmitters, chemicals, that a small change in those chemicals will lead to an to a turnaround of how you are supposed to see. Just if this glass that you've given me, that is the order in which they're supposed to be. If I change and bring this one behind here, the way information is being transmitted in my transmitter system will change. And therefore the way I'm supposed to integrate, understand things will change. And therefore, if I was to see you upright with your head up, maybe I'll begin to see you with your legs up. And therefore I begin to see, I'm seeing someone standing on his head. While you do not understand why, because for you, nothing has changed, you're seeing correctly. And that's why I'm saying that all those symptoms that I'm continuing to talk about, still the primary cause is the neurotransmitter. Now,
but as you continue, Daktari, does this person there is that have a problem? Or it's me will understand that you have a problem?
Thank you so much. Now, that is one of the symptoms that we shall be coming to it.
Okay.
There is something we call insight. Now, most people with mental illness do not have insight. Insight means understanding the environment and yourself in the real sense. That is appreciating reality. You're getting the point? It is 8 a.m. out there, 9 a.m. out there. There is a way when you look at the sun, like those people of us in the tropics, you can be able to say if this is 9, 10, and what have you. But you put you out there and you're telling us it is night. Do you think we can believe you?
Okay.
We will not. Okay? So that is, when we are treating these people, we aim at having them get insight. Which insight means that now the neurotransmitter transmission has gone back to normal. They can be able to understand and interpret situations and information and even time correctly. Okay? Yeah. So I was talking about hallucination. There are different types of hallucination. That's one of them. That is, we have visual, we have auditory. I'm here, then I begin to say I'm hearing the voice of someone speaking to me, and actually there is no such voice. Yes. So this thing is a hallucination, is that perceptual disturbance that is taken out of reality. The people that are near that person, that patient, do not appreciate what he's saying, do not agree with what he's saying. But for him, he's seeing those people, he's hearing that voice, he's seeing things walking on his hand, on his body, and etc. So the other thing is delusion. Now, a delusion is a false, fixed belief that is not in keeping, for example, with the societal norms. As Kithi, there is a societal beliefs and tradition. It does not agree with them. Even Christianity or Muslim, that is religion, does not agree with it. But for you, you believe it is there. For example, in some illnesses, you may find someone just believing that for him, his hair is made of fiber. And he believes like that. Can you touch? My hair has changed, is now made of fiber. Can you see that the house which I have been living in, which has been made of bricks, now it is mud. And he's convincing you that even you see, but when you look at the house, there is no change. So why is that happening? Is because his or her perception has actually changed. Are you getting the point? Then there is disorganized speech. There is disorganized behavior, which is not so easy, so difficult to explain, because when someone is disorganized, he's presenting himself. We also have to factor in the issue of age, perhaps educational level, sex, and what have you. Why? Because some behaviors can be normal to children. They may not be very normal to adults, isn't it? If we find you perhaps playing in mud, rolling yourself in mud, I may not really take it that you're playing. I may think there is something that is wrong with you. But when we are young, or we have seen children out there, playing in mud is in fact fun. They are enjoying it. Playing in rain is something that they can enjoy. But for someone that has grown up, someone that has some knowledge, it is common knowledge that perhaps playing in rain can be dangerous, not only in causing physical illness, but perhaps by the time it is raining, thunder can strike and it can kill you. You get the point? So there is a disorganization in that the brain is not perceiving that this activity, this thing that I'm doing can be dangerous to me. You get the point? Then there is disorganized speech, whereby I can try to follow your speech, I can try to follow you, but we cannot understand each other. Why? Because the normal way in which information is being transmitted has been deferred.
Or distorted.
Distorted or deterred.
Doctor, in some cases, you might be speaking to me or talking to me, but in sometimes I'm absent-minded. Can you say that I'm mental ill?
Now, to a great extent, yes. Why? Because what can make you to be absent-minded, perhaps, is when you're having something that is disturbing you. For example, stress. Some stressors can make me look at you, but actually my mind is in Mombasa. You get?
Yeah.
I have something that is stressing me, something that maybe some work that is incomplete, maybe I have a financial obligation which I'm trying to think of how I should be able to settle it, and I'm not really seeing the money coming. And so I am momentarily absent-minded.
Yes.
My mind is actually alienated from the situation around, and it is focusing on something very far. Now, to some extent, it is some stress that's actually causing that. And as we said, mental illness starts small. If that is not handled, it can go into something bigger.
Okay. Before we go to treatment, Daktari, who is at risk?
At risk?
Yeah.
That's a good question.
Yeah.
Yes. Before I answer that question, I finished only the psychotic line.
Okay.
It is mood. Just want to mention very fast in 2 minutes. Then I answer your question.
Who is at risk? Yes.
Now
you can do the symptoms and
so the symptoms. I've mentioned the ones I've finished are the psychotic symptoms. But then we have also symptoms that are due to mood diseases, a classification. Now we have a high mood, which is maniac, and then we have a low mood, which can be depressive, anxiety. Now in manic phase, we have things like grandiosity, where you find someone telling you is a big person, I'm a governor, I am a minister, I am a president, I am the chief of general staff. I had a patient who was telling me he's the president of the whole world, and etc. The army that is taking care of him is just in the next room, and that is a world where we are in. And you actually see that he's grandiose, his feeling is big, but actually it is because of a breakdown in his neurotransmitter system. You find also they are energetic, they talk a lot, they are talkative, they are not able, to control their speech. Sometimes they don't sleep, sometimes they eat a lot, and what have you. In the depressive phase, people don't talk much, they are more sad, they have lost interest in things or activities they used to enjoy or they used to do. You may also find that they don't eat. You may find that they sleep a lot or they don't sleep. Now, when you look at that, it's also related to some issues that are stress related. Now, I want to come to your question, who is at risk? Now, I want to say this way. We are saying mental illness. And by mental, we are referring to the mind. We are referring to the brain. Now, I want to say that if you have a brain, anybody that has a brain is at risk of getting mental illness.
Whoever has a brain.
If you have a head and inside it there is the brain, there is high chances of getting mental illness. That is the qualification number one. Because mental illness starts from the head, and if you don't have a head, then you cannot have mental illness. But then there are other things we say predisposing factors, or these things that make the likelihood of mental illness coming up. Things like stress, things like substance abuse, and genetics.
Okay.
Yes.
Before we go to treatment, Daktari, we want to understand about what's the difference between mental illness and when somebody calls you, you are a madman.
Okay. So first of all, I want to say like this. Mental illness is the agreed way, the known way, whereby symptoms have been assessed and they have been classified and have been found to be consistent with a particular type of mental illness. It has been done by people who understand, who have studied and understand what they are doing, how they are deriving the symptoms. But I want to say that calling someone mad is a bit derogatory in such a way that it is a straight word, and for us in mental health, we do not actually use it. So just like we have physical illness, we have mental illness. But you see, society over time has been having a bad perception about people that have mental illness. In most cases, they think they have angered their ancestors. They have angered their ancestral spirits, and it's the spirits that are disturbing them. And because of that, they want to associate them with all types of bad words. I'm sure when you go to the slums, you go to the streets, you'll find other words, not only mad. Yes.
Daktari, utaniruhusu kidogo tuende babu mskund for just 2 minutes, tuende madukani kidogo for a short commercial break. Tukirudi, about now the treatment.
Okay.
Mtu kiwa mgonjwa mental illness, nikiwa niko na shida na stahili kukuja hospitalini ama inastahili kuwa namna gani, and then utatuambia why we should be having mental health awareness month or week. Bado tunaendelea kuona watu wetu wanaendelea kuumia. Ujumbe taraika sibale ninki kugera turatware kirengaki tumago just nyuma gutebina. We are talking about mental health awareness and mental illness aroma tutebina why do we have suicide cases during their lives. So tuatwale mental illness nyingi usene ujumbe yatokongere kwenda kinde turasiumia sense media studio jide kaibere gatumai kwirana kegarani gotona Dr. Gideon akwendele tutwarira igore mangana mental health ikiagar kromonta natakiri gutwara afirengia maybe physical or mental in naliyo turasko chibusi nere tati burabu usikwera torika kerbosio tosuka nere tati burabu wagusi.
Thank you.
Etaya TV Oburabu Wagusi.
Super Medical Health Center Kise nige kumanya ngamba bwato burwalia asamarwiri buna brucellosis, infertility, stomach ulcers, weight management, diabetes, stroke, high blood pressure, kidney problems, spinal problems, arthritis, asthma, family planning, blockage, skin diseases, amunayanda mange.
Maria Tangoro Cross Mora, Super International Medical Center gotoko mochio Kisi. Ango chitole twarwaria marwaire mbali na ende twasite kurwari mwaka wa 2011. Kero wachire nyagitari yeito tubwate chimashini chigo komuleka. Mubero omugima gwansero mutubakaise. Igonto bwata Mario gako bakoni. Mario ga yako Los Angeles, California na ende twararwari ko 2011. Ande kare kwarinire gari asitogotoka na boikase Kisi Paris otwakeresi. Amario gaito aro sirikurwe mete mbali. Lakini naende tabwati chemicals kende kego chikugu affect yale original kabisa.
Nyurabono murwaire ni gotoko mokorero buringoria nyuma taramwa amariogo. Super Medical Health Center ni gotoka somo chubu songo angena Kisi Town Catholic Parish asamange. Bakire simiasi namba 0712 526764 wose 0736 888230. Super Medical Health Center. We treat, God heals. Tikiraba onye turakeiwa nago kerora image Etaya TV.
Bunabotambiriane Brighton Makori.
Eliane Diana Kwamboka Gisoi.
Bono kera lituko li Jumatatu.
Nainche Job Ungaga.
Jumanne.
Cheni konkoro kwa Eric Bosir.
Encheriane Evelyn Osero.
Jumatano.
Nche Joseph Mose.
Alhamisi.
Konkoro kwa Eric Maube.
Naboiko Ijumaa.
Cheni konkoro kwa Eric Bosire.
Neikendi ya gubono nigitabe Bunabotambe. Kera lituko li Jumamosi.
Nchinkuru kwa Sara Nyarangi Ontita.
Naso kwekura na koyichaka eike.
Eritriane Evelyn Osero.
Naboiko kurwa Etaya Jikosoli.
Konkoro kwa Kefa Nengo Bosire.
Igo tuyariganirie kweneke bunubura bwobo nkora babule nagoika asole. Etaya TV uburabu bwagusi.
Ne nobwate ebiasara gusemega uraganie tukubikirira itangazo ebene sukuru eduka inyagitari inyangi gose amatanga vono nabugutwakira esimi ase namba inoti sana ibere isato isano isato inoti kumanya mange monona buigona bugututarira asensemo ya Nyamataro Etaya House mwensi twabariganirie.
Kira abuna kugoikira goikabe akorirwo botuki gosakwa nabo gokunenkigwa nabasaki baito bamangana maya kurwase binyoroime nabo igo chinchera mone binchera asoko eneke buna goikere rimorioka totari komenta gose kurusia kende gionsi nageko gera credit kuli Alhamisi urachikubwata na mwananchi ase unenkio Alhamisi eliombengo korente ronsi buna bire kagwateka chinsa ibere nabo igo chinsa inye chiabotuko nche nigonkoro kwa Eric Maobe.
One familia igaikaransa kinde nyagitari iganga ikarururia nkonyire oboremo one kira yaonire ndenjemba chetiko uniform na njama imbe amanyi ne family
ondeta yokwanete komiti teyo ya ikaransete family te ikaransete ga mbere gento bunekyo so ntuntu arenga wea nga mbabwate sabu yomugo
nonye kero bari waka nabunya gitaria ebiri ba ntigirete malisti ali bari wakanira
ono ko abule na bana mwako yasirete kitwabere matoko makeigo ali tokonyaji senyenge kabatene to ebiri rende to mayenga je ebiri ya nyagitari irende ali ko ba cost yali go to cost bune family to erende na tonyero rende tolitike yani tolitike to mayenga ngaki
chibese chichi
no eba iretega chi akonyetega wana ndubwati copy and once ntomanye tikende
Etaya TV Omorabu Wagusi.
Buya kigimo mwanchu ndi beda darwishne kan tutuwati asebambi ya boniga anene katwale na Dr. Gideon awatware igoro yamangana tutakiri kuli yamangana mental health mental na afya pora si pora afya leo tena pora afya tu nelina medena na pora chakura durage durakni haya nena Gatutu ala afya erengia asemibrito na lio turaski ujibosu kitokanyiri to manne tata nya saira ne ruti bwa bia bana sababu batumire chumbe chabo goja sistringo jisomande kwa daktari tumerudi kutoka mapumzikoni. Now we were supposed to talk about treatment yes. Is mental illness treatable? That's what we need to understand. Yeah, doctor, welcome back.
Yeah, thank you so much, Brighton. Yeah, that is indeed a conversation, or rather a question that many people would like to know.
Yeah.
And definitely we will not finish this show productively if we do not give that information to the people. Why do you create awareness and leave people without solution?
That's it.
Treatment is the solution. Now, I want to say that largely mental illness is treatable. But just like physical illness, if you have your hypertension, if you have your diabetes, even malaria, that we know, if you do not seek help early, chances are like it will become complicated and can kill. You know that. So many deaths have occurred due to typhoid, yet typhoid we know is treatable. So many deaths have occurred due to malaria, yet we know that the whole world, malaria is treatable. So I want to say, at large, mental illness is treatable, but we advocate in most cases for early seeking of help and prevention. Yes.
You seek
early help and prevention, which maybe I'll talk about how to prevent mental illness.
We will talk about how to prevent. But Dr. when somebody comes to hospital, maybe I have malaria symptoms. You just take my blood and then you diagnose me and you tell me that I have malaria. What about mental illness? How do you diagnose mental illness?
Thank you so much. When someone comes to hospital, we don't just take your blood. That's for physical illness. You don't just do a venipuncture, take blood, and you tell the person that they have malaria or typhoid and what have you. One of the things that a healthcare practitioner does first, and it forms 75 to 80 and even to 90% of the diagnosis, is history taking. Someone will talk to you, try to understand the dynamics under which you have come, the signs and symptoms that you have, then we'll classify you in a certain criteria, and from there they want to do some tests, because disease, for example, like typhoid, you will have a high fever, that is high temperatures. Even in malaria, there's high temperatures. So what will distinguish between these two? Maybe we do some blood tests and we find out that you have got Plasmodium parasites in your system. Then we say probably this gentleman is having malaria. So that's a correction I wanted to make. But then also I want to say, so patients do not come to hospital and we just do a test and then we give them the treatment. No, tests may account to just 10 to 15%, and they only qualify or just reaffirm the diagnosis that the doctor has made. Now, in mental illness, you remember when I was talking about the symptoms, I mentioned hallucination, I mentioned delusions, I said disorganized behavior, disorganized speech, and sometimes you have negative symptoms. Now that forms a criteria that anybody who has, for example, psychosis must have those symptoms. Now, when you have those symptoms, you already have psychosis. That one, I don't even need to do a test and what have you. But why we do blood tests is because we want to reach the root cause of this. We have got like thyroid problems, thyroid function tests, T3, T4, TSH. When we do them, there is a certain variation. There is a certain level, titer, that is associated with depressive symptoms. There is also one that we call hyperactive goiter. We find that it's also associated maybe with some psychosis. So we do it, and then when we realize that it is the thyroid that is causing the problem, besides the psychosis that we're treating, we also give medication that will treat what? The goiter. You get the point? So we have physical illness causing mental illness. I get you my point? We have other things like, for example, diabetes. Diabetes because of high sugar levels in the blood, because the body, when a doctor tells you that you have diabetes, what they're actually telling you is that your body has lost the capacity to be able to manage the sugar that you have. That's just in a layman's understanding. That's what I should say. And therefore, that sugar, as it continues to accumulate in the body, it is causing other metabolic stresses that will impact onto your psychological mental stress. And that will lead to signs of mental illness. When someone has kidney diseases, you've heard of renal failure, kidney failure, people going for dialysis. Now that's the thing I'm referring to. The reason is because the kidney, which is supposed to say clean our blood, cleanse our blood, remove metabolic poisons, like for example, a lot of urea, ammonia. Ammonia is very poisonous to the brain. Once they are accumulating, if ammonia accumulates in the brain to a certain level, you automatically present with mental issues. You get the point? So we have had people coming from far because they don't have access to dialysis machines, dialysis equipment. They come, but the first thing is that they're being brought to the psychiatric ward because they're presenting with what? Psychotic symptoms. But then when you do some tests, you find that the greatest issue is the kidney. So what am I saying? We have got physical illnesses that will cause mental symptoms, and when you are treating, you will treat the mental illness and also do investigation in this case to discover that the kidney is the problem and also find a way to treat what? The renal issues. And I want to state here that mental illness is not only managed by the psychiatrist or the mental specialist, but it is something that we collaborate, because I will do investigation. I find that this person has a nephrology problem, that is a kidney problem. I will involve my colleagues that are physicians, and we manage this patient together. So it is something that we do collectively.
Yes. Dr. For instance, I'm not a doctor, but my friend or my colleague Makori has an issue, maybe physical or health or mental health, mental illness.
Yes, please.
Am I supposed to tell him that I've seen today you have reduced, today you have this challenge, because sometimes he can think that I'm doing stigma.
Thank you so much. Yes. Yeah. So stigma is one of the main causes of poor mental uptake. And it is all because of one of the things that I said, the association of the etiology or the causes of mental illness. If you told him that you have high fever, he wouldn't worry. If you told him you need to go and see a doctor, perhaps you have malaria, perhaps he will not be so much worried. I want to report
Again,
that...
it will depend the way you are on to tell him.
Yes. But I want to report that awareness and stigma issues have greatly reduced because of increase in awareness, like what we are doing today, and helping you to understand that mental illness is just as important as the physical illness, and that there cannot be anybody healthy in Kisii if they don't have mental health. If you want to run your estates well, if you want to do your work well, if you want to be a good father, a good worker, a good mother, a good anybody, your mental faculty must be in good health. And once it is not in good health, it means that you will not be able to run the home, do your work well, and conduct yourself effectively. And therefore, if there is something you should seek first, is to seek your mental health. Back to the question, I want to say this, that in mental health, someone who is sick may not easily diagnose himself. It is the people that are around him that will be able to realize. There are a few cases that enlightened people like me and you perhaps can say, but the way I am thinking, my memory is reducing. I think there's a problem. I need to see a doctor. I have been low, my mood has been low, and before it gets worse, I need to seek help. A few people can think like that, but many people leave it until it is too late and they have lost capacity to be able to recognize what they're going through. That is pass correct judgment. Now, passing correct judgment and knowing that I am sick, I need help, you have insight. But then when you're not able to know that you are sick and you need help, you don't have insight. And in most cases, people come or people seek help or people are brought to us when they do not have insight. And therefore, it will be good for you to find a way to talk to your colleague so that they can be able to seek help, so that the condition does not get worse and worse. Yes.
Doctor, do you think that this mental health awareness imesaidia?
Thank you so much. Yeah, I want to say that mental health awareness has really helped to transform the community, to reduce suffering, and to help people seek timely treatment. Now, I want to say this. When you look at the history of HIV, people used to be so stigmatized that at the mention of a diagnosis of HIV, people thought that was death sentence that has been spelled for them. Therefore, they could go and hide. They don't want anyone to know. It was associated with something bad, and they wouldn't want to come out openly and share with people. But due to the awareness campaigns that have been conducted in the 2000s and the late 1990s, according to history that I read, I may not have been there to see that, you realize that the uptake of this information has continued to increase. And when someone is given a diagnosis of HIV, they know that they are not going to die for as long as they continue to seek help. The same thing applies to mental illness. There is a lot of campaign, and whenever the campaign has been done, we judge it by the number of people that come for treatment. I want to say that the number of people currently that are seeking mental illness, mental wellness has really increased. Statistics is showing that there is now information that is going around the community. The communities have begun to demystify the beliefs that they used to have about mental illness. And I am optimistic that as we go on year in, year out, like in a year we have one in May, the whole month, we have this August, we have October, we have August, which is a substance abuse month, and what have you. That has continued to transform the society, and we are hoping that at one time we will be able to turn down these statistics that 1 in every 10 Kenyans is suffering from mental illness, because early seeking will enable that person to get healed, and even to help their family, to help the community, to help the people where they work for to not have the illness. I also want to say, people who are managers of corporation, managers of banks, they need to have this thing done periodically to their members. For example, in the month of August, I think, around 25th, we had a judicial mental wellness day, and I appreciate so much, because one of the things that you realize that in an institution, there is institutional stresses that normally come up. And when they are addressed by someone, an expert who understands, there are chances that people converting, turning to the other side, and gaining great capacity to be able to maintain, to be able to control and manage their stress, helps them from converting or getting mental illness. And therefore, awareness is key as matters management of mental illness. Thank you so much.
What about, we have the high license of suicide cases?
Yes.
You have seen them in the society nowadays. Does it mean that we have mental illness which is causing suicide cases?
Thank you so much for that. So suicide is actually an extreme of depression. In the early criteria, suicide used to be among the last in the criteria for mental illness, for diagnosis of depression, that is major depression. But now, because when in health generally, whenever a study is done and it is found that this particular thing, this particular symptom can be associated with even loss of just one person, it becomes very significant. And therefore, I want to say that suicide has been on the increase in the society. One of the reasons is that the stressors, hard economic times, have actually contributed to this. But then, not only that, people have not gained what we call resilience. Resilience is that inbuilt, that capacity to be able to withstand stress, to be able to cope with some things when they come your way. Someone has maybe not done her exams or his exams well, says, I'm hopeless, I don't see life being important to me, I think I should take away my life. Someone has a court case, like I witnessed one, who I'm told just opened the well and entered inside. Someone has a court case, they are about to conclude. The way things that are moving, he's likely not to win the case, and perhaps he's going to be imprisoned for more than 10 years. The person decides to commit suicide. Now, it is just their incapacity to manage stress, but also not having a good social relations with people. When you have good social relations with people, your social network is bound to strengthen you in times when you are low, and there are times they are bound to uplift your spirit, and that helps actually you to go a long way to be able to manage stresses. So I want to say that yes, even we are having a World Suicide Prevention Day, and it is because it has been noted that suicide is taking away quite a number of people. Yes.
That's very nice. Before you give out your closing remark, because we have around 5 minutes to wind up, who is supposed to champion this mental health awareness?
Thank you so much. All of us are champions of mental health awareness. I want to give an example of major chronic diseases, HIV, diabetes, renal diseases, cancer. All of us are supposed to be champions of all those diseases. And therefore, the other elephant in the room actually is mental illness. Because if you don't have mental health, like I said, you cannot champion prevention of diabetes. You cannot champion prevention of cancer because you will not be able to appreciate them. You will not be able to know actually what you're talking about. So me and you, or every society, every organization, that's why I was talking about organizations, banks, and what have you. They should ensure that their people have mental health awareness. And when we do that in our families, in our communities, our leaders, yes, we have seen some of our leaders talking openly about it, even being given such platforms is important. I know it's a product of what our leaders are doing. Doctors, you know, talk about the National Assembly. There are even laws that are being enacted to promote this mental illness. And therefore it is important for us to know that championing mental illness, mental awareness can be championed by them that are specialists in that area, but they need good cooperation by the community and by even the leaders. Yes.
Dr. I would like you to give your a closing remark, either general advice to the public in terms of general in the health sector. Thank you, sir.
Yeah, thank you so much. I must say, Brighton, I've been honored to be hosted by Etaya TV and to air out to a greater public matters mental health awareness. Now, just to conclude, I want to say that mental illness is treatable, especially when you seek help early. Mental illness is just as important as physical illness, because when you are mentally unwell, you may not be able to run your activities well, run your home, run your estate, plan well for the future, and manage currently what you are having. I also want to say that you can organize yourself in such a way that you are able to cope with the stress. I want to categorically also say that stress actually comes out as part of life. At one stage, as a student, you finish your studies, you begin to look for employment. It takes long. It will definitely be stressful, but you have to find a way of managing that stress. That's what we call being resilient. You may want this, Brighton, you may want to own an aeroplane today, but you realize maybe you don't have that capacity, that money to buy that aeroplane, and you've not even made a runway in your home. And therefore, you realize that I cannot kill myself because I'm not buying an aeroplane today. I take a step at a time. It is therefore important for us to know that being resilient, seeking help early, and following the instructions that you're being given by the healthcare practitioners is one of the important ways that we can be able to manage mental illness. Thank you so much.
Thank you very much, Daktari, for making time. So just studio tumeongea mengi kadoro kwanda mangana mental health awareness simambi yaboniga. Daktari otutebiria mange anotebiria tutakiri kwerenda wika twerende ekogera kura kubato majando nabo kwanda nyagitalende oligireriwe ekogera na utarigerere mapema nabo konyora na wasirio mabwao because tonyore na karo gutwara mental illness goikie na bego na bogo ko sirio bugma bwao go nditukurani gutwara ngana Dr.Gideon Munaru kurwa sinyi gitali ya Etaya sindio? Yes. Na ukorogo shout out abantu babiri batatali wawili watatu tutawasalimia. Unajua kuna watu tutapata kwa Etaya walikuwa na kuangalia daktari. Yes, tutawaambia shukrani.
Yes. Okay, thank you so much for tuning in. Thank you so much our viewers. We have discussed a few things here, but they are very, very integral, very pertinent. But we also want to say that this conversation cannot begin today and cannot end today. We know that we have another time.
Yes.
Thank you so much.
Sana to ukipata CEO Malita tutamsalimia na wengine huko. Waambie Etaya TV tunawatambua kweli kweli. Asante kwa kupata muda wa kuja kwa studio. Pia bano mwanchumelia singenje kwa bera manaintwe twatemire sana kurudiaga kietu ikaboniga. Sarah was not around but she traveled to Mombasa. Maybe kesho tutupea link kutoka huko because there is a certain function yenye huko atatuambia itakuwaje hapo kesho. Ndonyora nere maambia sita April show with us nsemeli ya mitandao. Kwa niaba ya timu ngima Joshua utakura sema transmission Jose Makoto kwa sema ye kamera ni ondoje Ruth Kema no alinere kwa sema ya transmission. Ni mashukuru sana wakisha kwamba kirento kia bere bekuru 12 mpaka pone kadoto ijide kai 10 atukichinso yenye chabo na mankulengana ne moro berweta April show aere gaiga nyasaga kongachana wanje tromerne chinsa isano ibiri chamba so ndingore tera mangana mayibe na ndete gwate kai mena isiku ya usi igo tigambatike na nyasaye wikachinga kicho igo teba gukora maya igekugerekerura arare maya itakuwa ndama usituko kwane bobe ire ni ta TV uburabu bwa usi. Thank you so much. Thank you.